As you have heard, I'm from Namibia, Minister of Health for my second year, but I stayed in the private sector for about 50 years as a practicing doctor. We just want to highlight a few points which I think are a real opportunity to engage the private sector to strengthen the partnership between government and the partners in the private sector. First of all, is infrastructure. We have the planned design, even have drawing. I have them on the USB, they can show later. Major infrastructure project which we want the private sector to be our partner. The first is the renal dialysis that we want to set up. Please don't laugh at me that we have very limited capacity in the private sector, the public sector as far as dialysis is concerned. We want to build a renal dialysis in Bindu. For those of you who have an idea where Bindu is, at Shakati is a northern town, and Rundu, northeastern town, bordering Namibia and Angola. The other thing we want to engage the private sector is on equipment. I also had a discussion with General Electric, and I believe their representatives are here, and other companies that supply equipment such as Philips and others, there are many, to consider the model which I understand is working perfectly well here in Kenya, of supplying all the equipment from a basic portable ultrasound, cardiotograph, ECG machine, CPAP or incubator, because these are our challenge, up to the most sophisticated equipment like a CT scan or MRI scan. So we want to have an agreement with someone who can supply, replace them, service them, maintain them, but also capacitate our local people, young people whom we want to become a technician, to be trained during that period. We're looking at it, because what we have experienced is that the moment you replace one small instrument here, the budget gets squeezed or the country gets rated down, and there's always financial problem. Government will never provide everything that you require. We have to have the private sector. And then come logistics. I have heard somebody talk about logistics here. We just launched, and I have it on the picture as well, if it can be put on the screen. We launched our computerization of supply management and stock management at our central medical stock in Bindu, with the help of US government, and we're very thankful about on that. And we now just realize that we don't have the capacity to manage our supply management, pharmaceutical supply management especially, to which we spend about $50 million US. Also, the transportation of our medical stock from Bindu to this district is a challenge. We don't have enough efficient mechanism to see that the stock is not disappearing. It's not overstocking when ordering, it's not understocking. We need a company, such as those companies that are managing the logistics of the ShopRites, those who know ShopRite, or big retail sector, or any other person or company organization that can manage these things for us. The other one is the what we call the support services, and this is now already ongoing. There is a tender for catering, a tender for security, tender for facility management, all of this. We think it's only the private sector that can help us out too. Infrastructure, on ICT infrastructure as well. We want to migrate completely to electronic health records. We have engaged a few companies. I was in Cambridge in February. I met the big data group from Cambridge. They were in Namibia to have a look at our infrastructure. It's a company that did the NHS, and they showed interest. We still want more on board to migrate from paper to paperless electronic data. Obviously, the challenge there is big data. I heard somebody saying something last night. And I think the English people were worried about the safety, even on the cloud, of their data. So I hope, and I believe there is a way to get around that. And then comes pharmaceutical manufacturing. I have a lot of emails coming to my office, everyone wanting to set up a pharmaceutical manufacturing. But Southern Africa, Eastern and Southern African ministers of health have taken a resolution there. It's better to jointly build a manufacturing plant in partnership with the private sector. I met with a gentleman in Frankfurt in June from Merck, and I had a few exchanges with this gentleman on the topic. He said Mozambique set up a pharmaceutical plant on their own. They're now battling, and one of the reasons is the market. And Mozambique has got about 10 million people. Namibia has got about 2.3 million people. So there's absolutely no market. And people come and tell us, no, we put it in Bindu, but the whole of SADC will supply. I said, look, it's better if you involve them as partners, then at least they can guarantee the market. Well, I'm not an economist, it's just a layman's thing. But I still believe that is the way to go. Government as sleeping shareholders, guaranteeing market, private sector as the managing agent. You know, to be efficient, we need the private sector to manage these facilities. Government can't, at least my government can't, you know, others may be. So those are the 3 points that I want to highlight. Ladies and gentlemen, once again, thank you very much for your attention.
Thank you. I think you've got a fantastic list, and many of the points, Bernard, that you mentioned are going to be covered during the session, during the 5 days, so there'll be a lot of interactions. David, is that competition sitting next to you? If he's going to put up one plant in neighboring countries, so you serve the whole region. So really, Zimbabwe is also one country that's been on the news. We've heard a lot of transformations going on in the healthcare. Where does private sector fit in to your roadmap? Just paint a picture for us for Zimbabwe.
Thank you, Amit. I was hoping that to give a speech. I prepared a speech. Now you're asking us questions.
I know that it's still right.
That's still okay.
It's still working.
It's still okay. Well, let me thank you for this meeting. I think it's really a groundbreaking meeting for us. And it's a good platform to share what the private and public sectors came to together. And I want to congratulate Kenya for hosting this. But it's so important to understand the dynamics of individual countries. In Zimbabwe, the population is about 14 million, 52% of whom are women. And out of that, 98% of literacy rate within Zimbabwe is realized. So you find the Zimbabwean population is a very highly educated, mobile population. That's why you find a lot of Zimbabweans all over the world. The other day I went to some group of Eskimos, and they didn't expect any Zimbabweans. They found Zimbabwe there. So they're really everywhere. And it's partly because of the policy that was enunciated in 1980 of education. So there's a lot of educated Zimbabweans. But having said that, the dynamics in the health sector is that a lot of investors who come to Zimbabwe prefer to invest in areas where they can make quick profits. If you put roads, for example, where they know there's going to be a toll gate and money is going to be recouped, they're happier with that. Or railways where they know the money is coming. But the health sector is a social sector. It's a difficult sector to invest in. It needs people like these that are here who are committed to the health sector. And I'm glad that you have convened this to realize that the health sector, whatever you do, the most important thing in your life is your health. And often as governments, we don't recognize that. That is why sometimes budgetary allocation is not as strong as it should be towards the health sector. However, the major investment area that we need and to continue to want is in human resources for health. We continue to need that. We train and retrain. but we lose this. That trend is still going on. We've got specialists that are in Europe, from Zimbabwe, and we urge them to come back for an exam. But the attraction of pull factors to other countries is huge. So when you are looking at investments, that's one area. The second area is infrastructure. Not to you for you to come and build. No. But the infrastructure of what is to be put inside hospitals. Like my colleague has just alluded to, in terms of equipment. We have divided our country and said the main hospital in Harare, which happens to have an appropriate name called Parirenyato, that main hospital is now doing open heart surgery. Now that is the sort of investment of quality care we want. People are still going to India, to China for treatment, but again, you've already spoken about this. We want to stem that tide and have people treated at home. At a place called Chichunguiza Hospital, we're aiming at renal transplants. Already they're doing renal dialysis and other things, but we're pushing towards renal transplants. That needs a lot of investment. We are now also looking at our hospital called Harare Hospital, which is the real big hospital. And that, 2 years ago, they did the separated Siamese twins. And that's a landmark issue. So I was making that hospital specialize in pediatric care. So we're looking at these centers of excellence in the various institutions and hoping that investment will then come in to address what we want to make. The pharmaceutical industry, the private sector in Zimbabwe is very strong. We've got in Harare alone, we've got 22 private hospitals in Harare alone. If I don't count the small surgeries and hospitals, they're all over. And this is an area, I think, when I'm saying that we've got a very strong private health sector, which complements the public health sector. But this private health sector cannot be strong if the public health sector is not strong. That is not going to happen. The fourth area that we must invest in is investment in terms of funding, particularly for the out-of-pocket poor people. This is where the insurance business comes in, the risk management of that, national health insurance schemes, how they can be complemented with private medical insurances. In Zimbabwe, the medical insurance in the private sector is one of the strongest, but they cover only 10% of our population, and the 90% are then covered by government or out of pocket. So that is an area that can have a lot of gymnastics for investors to come in and look at that. So these are areas, I think, that if you look at, Amit, we had in Zimbabwe an HIV prevalence rate of 27%. And what we did then, we just used 3 strategies. The first strategy we used was prevention. The second one was prevention. The third one was prevention. And those prevention measures, the HIV prevalence has dropped like that, buttressed by the educated population and in terms of behavioral change. Now, we are looking at a prevalence rate which is still high, but very low, and we don't expect it to go much lower because there are now ARVs. So that's another industry in Zimbabwe where we need people who can build a factory for condoms. Condom use is one of the highest in Zimbabwe per capita, and we are reckoned to be #1 in the world per capita use of condoms. Per capita use of condoms. So we want a factory for condoms. Interesting. Which would be complemented by the factory for making gloves, besides the issue of ARVs. So I think for now, we will just say we are embracing the private sector in a big way. And I think the players here will find Zimbabwe not because of the Victoria Falls, but in spite of the Victoria Falls, that they want to come to see what they can invest in Zimbabwe. Wonderful. Thank you. Thank you.
And it's not the Victoria Falls that has led to the highest use of condoms per capita. But I think the list that David you gave us shows the transformation that we've been reading about and the engagement with the private sector in Zimbabwe. I think your roadmap is pretty clear. The laundry list that we saw from Bernard is pretty long, and I think pretty honest as well, going into dialysis. And in your case, you've got broad areas that you see yourself engaging the private sector, including financing, pharmaceutical areas. I'm sure many of us are going to engage with you much more. Ruth, Ricky, thank you for coming from the neighboring country. It's really a pleasure to have you here. I know you were a little bit late last night. We've been really discussing private sector since morning. Uganda has also gone through a really important tidal change, and also being part of the East African zone and the EAC. Just tell us about your Ugandan interaction with the private sector, and where are the strengths and what are the asks of the many East Africans who are here sitting today looking at opportunities to immediately engage.
Thank you very much, Dr. Amit. And again, it's wonderful to be here after the TCAT. And allow me also to thank the government of Kenya for hosting us. And to thank you for making sure that I am the only female on this panel. I think Dr. Amit is not gender sensitive. We'll discuss that outside after here. Dr. Amit, the government of Uganda values the private sector. And to begin with, we have had 2 surveys so far, because we were asking ourselves, what does the private sector contribute to health in Uganda? And it came out very clearly that about 42% of our health services is provided by the private sector. And again, we went ahead to evaluate the quality of the services, and it was quite impressive. And from that minute on, the government said, yes, we must find a way of working with the private sector. But how do we work with the private sector? There must be an enabling environment, there must be laws in place, policies in place, so that we work at a level that is acceptable. And so we have a private-public partnership policy in place, and we're now working on regulations that will bring the private sector together with us on board at the same level. But what are the major areas that really we need to partner? And one of them has been in the pharmaceutical industries. And I'm sure many of you know about a very vibrant pharmaceutical industry in Uganda, and that is Simpler Quality Chemicals Limited, that is supplying antiretroviral drugs, supplying anti-malaria drugs, and many other commodities, and we've gone ahead to expand. We make sure that as a country we procure from this pharmaceutical company. And I believe that, if we partner together with Africa and, promote such an initiative, it will go a long way in promoting health in Africa. However, we have also realized that a very important area that needs to be addressed is the issue of medical tourism and medical treatment abroad. Many of our African countries spend huge sums of monies every year sending people for medical treatment abroad. And yet, if we actually partnered with the private sector and we had such facilities within the African countries, we would save a lot of hemorrhage. And Uganda has gone ahead. We are going to have, a public-private partnership and have 2 internationally specialized hospitals constructed in Uganda with the private sector, so that we can address the issue of medical tourism abroad. We have been discussing a lot about equipment, leasing via, equipment supply and maintenance, because we waste huge amounts of money. Equipment's coming, you install them, you can't maintain them, you can't run them, the personnel are not there, it just doesn't make sense. What if the private sector took over? What if they provided the services? Like, the kind of model that you have in Kenya or any other model based on leasing, perhaps it would save, our African countries lots and lots of money. Of course, the other area is all of you are realizing that the private universities are now generating many more of the human resources for health more than the public universities. And if we partner with the private universities and actually look at the needs of the countries, not only the general needs, but the specialized needs versus the general needs, these private universities could actually give us the specialties that we need to run our private health services as well as the public health services. So I think there is great opportunity for people to talk, but we need to talk. What are the goals? What do we really want? How do we need to move? How do we move together so that we achieve? Because there are definitely private companies that can partner with government, but what are their goals? What do they want? Are they in for profit? Are they in for value? Are they in for quality? Are they in for universal health coverage? What do they want? And what do the governments want? The governments are looking at providing services for the people at a cost that is affordable and a quality that is acceptable. So there has to be a point where we all come at the same level and say, yes, if this is where we want to go, what are the areas that we need to address together? And what is the enabling environment? Without any interference, whether it is economic or political, so that we can get there and address the issue. Thank you.
Thank you. That's wonderful.